Preceding slides will discuss the changes to the SECOR program beginning January 1st, 2023. Today's objective is to provide an overview of the new Element J, Health and Safety Representatives, or REPs. Element J is a new element regarding health and safety representatives and is specific to jurisdictional requirements. There are 7 questions in this element that focus on a policy and procedure for health and safety reps, their duties, training requirements, proof of participation, a system for reviewing complaints or concerns, and contact information for the rep. The purpose of this element is to create a policy and process that identifies an individual worker rep who works with the employer to address health and safety concerns and their required responsibilities. Questions in this element may be marked NA if the employer is not required by legislation to have a health and safety representative. For example, small businesses in Alberta with 4 or less employees do not require a rep. Now we'll focus on specific information within element J. Question J1, is there a designated health and safety rep per legislated requirements? The requirement for this question is a policy or procedure that outlines at minimum the requirement to appoint a representative, how the rep reports to management, terms of office, and training requirements. You will need to check the legislative requirements for your jurisdiction as they vary from province to province. For example, Alberta requires workplaces, whether fixed or field locations, with between 5 to 19 employees to have a rep. BC requires workplaces with between 9 to 19 employees, and any workplace where there are 9 or more employees employed for longer than 1 month to have a rep. And Saskatchewan requires high hazard workplaces with 5 to 9 employees to have a rep. Question J2. Are assigned duties identified for the health and safety rep as per legislated requirements? Duties of the health and safety rep must be written to include the expectations of relevant jurisdictions. For example, in Alberta, health and safety reps are required to participate in the hazard assessment process, make recommendations about worker health and safety to the employer, complete and/or review worksite inspection records, support work refusals, and support the development, implementation, and review of violence harassment plans. This question may be marked NA if the employer is not required by legislation to have a health and safety rep. Question J3. Is the health and safety rep trained in their duties and responsibilities as per legislated requirements? The requirement for this question is training records. You will need to check jurisdictional requirements as each province has specific training requirements. For example, Alberta requires reps to receive at minimum 16 hours of training annually, whereas BC requires reps to be trained as soon as practicable, but not more than 6 months after becoming a member and receive a total of minimum 8 hours of instruction. Question J4. Does the health and safety rep participate in health and safety activities? Supporting documentation that shows participation in health and safety activities is occurring can include items such as inspection reports, completed investigations, or health and safety complaints from workers. Question J5. Is there a system in place for the health and safety rep to address employee health and safety concerns and complaints and provide recommendations to the employer? Supporting documentation can include a policy or procedure that identifies how concerns and complaints are received, for example, by email, by hazard identification card, or in person, and then how those concerns and complaints are addressed. Question J6. Are health and safety concerns and complaints resolved in a timely manner as per legislated requirements? Supporting documentation needs to include examples of when concerns and complaints are received and then when addressed. Types of documentation can include emails, hazard ID or near miss cards, or meeting minutes. The key is that the documentation needs to be dated when it is received and then when the concern or complaint is addressed. Question J7. Is health and safety rep contact information readily available to employees as per legislated requirements? Supporting documentation can include a note that explains where the information is posted and how it is accessible to employees. For example, it is posted on a health and safety board located in an office or is available via the company's intranet or an employee handbook. We'll conclude today's presentation with additional resource information. ESC has created a one-pager that includes definitions, audit requirements, and guidelines, as well as links to additional resources which can be located on the ESC website under Core and then Materials and Resources. Additional information regarding legislation for Alberta's employers can be found on the Alberta OH&S Legislation Search tool under search-ohs-laws.alberta.ca. Additional information regarding legislation for British Columbia employers can be located on the WorkSafe BC OH&S Legislation Search Tool site. A bulletin with additional information regarding Joint Workplace Safety and Health and Safety Committee information is available through the Alberta government. WorkSafe BC provides a similar resource page. Additional information for Saskatchewan employers can be located under the Saskatchewan Employment Act, Part 3, Occupational Health and Safety, Division 4, Occupational Health and Safety Committees and Occupational Health and Safety Representatives. And finally, a list of additional resources. Alberta and WorkSafe BC, OH&S e-News, Canadian Centre for Occupational Health and Safety, or CCOHS, webinars on demand from ESC, safety bulletins available on ESC, and in-person mentoring and workshop visits. That concludes today's presentation on the SECOR Element J Health and Safety Representative Audit Tool updates for 2023. If you have any additional questions, please email coreinfo@energysafetycanada.com or call the hotline number at 1-800-667-5557, option 3. Thank you.